Hello and a very warm welcome to you all. I'm Vikas Nangia with TV Asia's CyberWatch, a program through which you get to meet technocrats, entrepreneurs and subject matter experts. Ladies and gentlemen, as COVID-19 public health crisis continues to unfold and evolve, the health sector has emerged as an appealing target for cyber attacks. Today, with our special guests on the program, we'll discuss on the topic impact of cyber on healthcare sector. My first guest on the program is Chief Information Security Officer at Healthfirst, Latesh Nair. And my second guest on the program is a very familiar guest. He is the founder and CEO of DigitalXForce and iTrustXForce, Lalit Ahluwalia. Lalit and Latesh, thank you so very much for joining us on TV Asia CyberWatch. It's a pleasure to interact with both of you. Let me open up with a conversation and let me get your take on the topic, impact of cyber on healthcare sector. Latesh, what would you say?
One of the main focus around cybersecurity is like the impact is like more around the quality of patient, which is whenever you have a big impact, the quality of patient really goes bad in the sense you're not able to access the patient information, you're not able to provide the right level of treatment, you're not able to provide the right level of patient clinical data set to the hospitals. So there are impact is just goes beyond control, right? So you need to have that right level of controls and enablement, making sure the patient doesn't get impacted, right? So we have to make sure we have the right level of people training, right level of security focus around the products and the business functions. So that is very important. And at the same time, if you don't have the right level of data, the impact can also tarnish the brand image of the company, right? Which we always think that, there are some major impact, but you don't know where the impact is leading to, because that tarnishes the brand image, the reputation goes for a toss. People then don't want to come to the same hospital or the clinics, right? So those kind of things really hampers for a long period of time.
Right. So let me get the views from Lalit on the topic, and then I want you to kindly elaborate for us when you say data. If you don't have right kind of data, what data are you referring to? Lalit, but let me first get your reaction on impact of cyber on healthcare sector.
So Vikas, I think this is a very important topic, and I think if anything else, audience should be very much particularly watching this segment. Why? Because healthcare in general is a big target for the bad actors for a variety of reasons. Think of this way, not only your personal identifiable information, means your sensitive data, your social security or your credit card data is there, but what is also available to the healthcare entities is your protected health information.
Correct.
Something that goes even beyond that. What Latesh was talking about, the patient care. Think of this way, you're trying to go to a doctor's office. In order to really get a quality healthcare and quality care, they need all the data to really kind of serve you really well. But if I hijack that data and also hijack the means to really conduct healthcare procedures, it really becomes hard. And this is exactly the reason why the bad actors really want to go after it. By handicapping you. That's the reason why there's certain kind of attack called ransomware. If you really look at the news, one of the most common breaches that really happen in healthcare is ransomware. Ransomware is nothing like, just like, किसी को kidnap कर लिया, फिर मतलब हाँ भी हम तुम्हें तभी वापस करेंगे जब हमें पैसा दोगे. The same concept. We are now kidnapping or holding hostage your critical data or functions that you cannot perform.
Right.
And you will only recover when you pay us the ransom.
Right.
That's become a very common thing. Also, for the people to understand, healthcare is a big domain on its own. There is, at least at a very high level, there are two kinds of healthcare entities. One that you commonly go to the hospital for the healthcare and all. They're called providers. वहाँ पे doctors आते हैं, मतलब दो आपको मतलब इलाज करते हैं, and patients go and get the treated and everything. Then, because where we live in US here, we are also very insurance driven culture here.
Correct.
And the insurance goes through the payers.
Right.
So you kind of have insurance that you claim against your medical and everything. All that processing of the claims and the billing is going through the payers. So these are the two entities which are very, very lucrative targets for this one. But all in all, because of the nature of how the healthcare has been evolving and how distributed that has been, it's a very high target for the bad actors.
Right, and the way you've explained me, by some accounts, I also feel that the healthcare sector is the most vulnerable. Latesh, when you were giving your take on the topic today, you also mentioned about the data. Can you elaborate more?
I can give a good classic example, right? For example, like a patient is having a chronic problem. He's in the hospital, right? Like he's suffering from some major health conditions.
Let's say pain management.
Pain management, like some severe problem, right? And let's say you need to get the medical records of the information, the clinical data,
correct,
right? And if you go in the hospital, there's always a staff that keeps rotation, right? So typically what happens is when you want to get the data, and if that has been hacked, they cannot see the data on time. They cannot even provide the right level of prescription. Right. So imagine the pain and the problem that can create to the patient, to the staff, to the doctors, to the entire ecosystem. Right. So that's like the health conditions can be severe to the cancerous patient to the the low level patients.
Correct.
But imagine the severity of that, right? So that's something. If something happens to the IoT, like there are a lot of devices that gets hacked these days, right? You are not able to pull the data, the clinical records, the notes, and that's something very severe.
Right.
I feel that needs to be protected at the first level.
Right. And in my observation, as much as I've interacted with the doctors and medical professionals as well, I've been to some of their conferences, the focus, of course, is more on research and treatment and buying the new medical equipment, less on the digitization and cybersecurity. That's not even on their priority, and they're so underfunded with this area. And so that needs much more attention. Lalit, what would you say?
See, it's a kind of like a chicken and egg problem here.
Right.
On the one hand, you really want to make sure your healthcare methods or healthcare is more advanced. And hence the investments need to go into the R&D. It needs to go into the new age technologies.
Right.
And these are of course, when it comes to treatments, they are costly affairs. They're not easy. On the other hand, where the balance doesn't strike is when you go for all that, but you don't care about the fundamentals. Those same technologies in today's age are being delivered in a remote fashion. They're being delivered in a smart fashion. Like IoT and Internet of Technologies, your smart watches,
telehealth monitoring.
They put pacemakers for the heart condition monitoring.
Right.
Almost 10 years back, there was a case when pacemakers got hacked.
Wow.
Now imagine the device inside you is now malfunctioning that is supposed to keep you, healthy or even alive. If that is hijacked, who's going to pay the price? Who's going to recover somebody back from when the life is lost?
Right.
And this is where this is important now. There's an awareness. There's a need. I don't think that anybody will ever deny now that we need to ramp up the cyber security or the defense mechanisms. The challenge is the prioritization, as you rightfully said.
Right.
Where is my priority now?
Right.
And usually what happens is, just to add on to Lalit's point, the hackers are much more smarter in a way. They know where to attack and what to get the money out of it, right? And we are more reactive. You always think once the attack is done, right? Then you put more controls, more, all those bells and whistles around the product, and then by the time the damage is done.
What are some of the critical cyber attacks in the healthcare sector?
One of the main threat we have seen is the data loss, right? Which we have a DLP solution right now. The data breach is the biggest problem, right? Sometimes we see there are some employees, they don't know what they are doing sometimes. They have a lot of access to the system, they have a lot of controls, and they send the data through email, and there are a lot of phishing. They keep phishing and make sure somebody will actually click the phishing button, right? So the data gets leaked in the market. So if you look at the Anthem breach, which happened about a couple of years back, there were the Emblem, they had small breach. So there are a lot of companies, they have breaches because the employees have a lot of controls on the data side, and they don't have sufficient adequate training around the type of usage they need to have. Right. So that's something that the leak has to be protected from within.
Right.
Because the external attack, definitely that you can put a lot of controls, but there are beyond that you cannot do much. But अंदर से जो है, which is within the company, right level of training, the right level of entitlement management, right level of access controls, and the right level of protection. With some data leak happens, immediately there's an alert that goes to different types of security team to make sure this will not happen.
Right.
So all those things, it has to be done the right way.
Talk about the vulnerable part over here.
So the vulnerabilities और जो exposure है healthcare organizations का is unbelievably like even beyond your own reach. So think of it, हम यहाँ स्टूडियो में बैठे हैं
जी
ये हम खुद guard कर सकते हैं because we know the territory, we know the boundaries, we can guard it. Now hospital chain, think of now what hospital chain is dealing with. They're dealing with a lot of like suppliers on the technologies.
Right.
Third parties, yeah.
The third parties, like, for variety, like including nurses, the staff and all that is coming, okay? Now, as Latesh also said, a lot of this staff has a lot of access given to them. Who is monitoring that access?
Right.
Because as a bad actor now, I'm watching wherever the loopholes are, right? Wherever there's a weak spot, I'm really gonna really kind of hunt it down. That's my thing. And when you are already distributed, you don't even know कि आपके कितने building में कितने दरवाजे हैं, कितनी खिड़कियाँ हैं.
Sure.
तो कहाँ से आप बचाओगे?
Correct.
That is one of the big things, where healthcare is very dependent on a lot of suppliers, the vendors, the third parties that's come at risk. दूसरी जो चीज़ है is the trust factor internally. आप healthcare business में हो, you're trying to protect people's life. Nobody is even thinking about really thinking in कि मैं data hack करूँगा या मेरा कुछ होगा ऐसे, right? So what they're really going ahead with this notion is everyone who's in here, give them access. Means
Right.
there's no segmentation, nothing, which I think has to change now. It has to change because when I get in one, I can actually access anything and everything.
Mm-hmm.
So a lot of things that between third parties to internal, and then there's something called OCR, Office of Civil Rights, that publishes the HIPAA and the iTrust, the regulation. There's a reason for that. So that even at a small business provider, healthcare provider to the largest one, they really at least comply with certain regulations. आपका sensitive data है, protected health information, मेरी machine पे पड़ा है, और मैंने उसको encrypt नहीं किया है.
Right.
कल कोई मेरी machine उठा के ले जाए and सारा data उसके पास है. Would you like that? Probably not.
Correct.
So the
Correct.
basic principles, that's another set of vulnerabilities.
We're going to take a quick short break over here. On the other side of the break, viewers, when we resume our conversation with Lalit and Latesh, we'll ask them about how to protect and safeguard these cyber attacks on healthcare industry. We'll be right back after these messages. Welcome back. You're watching CyberWatch. Ladies and gentlemen, today on the program with our special guests, Lalit Ahluwalia and Latesh Nair, we're discussing on the topic impact of cyber on healthcare sector. Lalit and Latesh, once again, welcome to CyberWatch. And just before the break, we were discussing about the situation that arose with Change Healthcare, and you gave some good references. And the question that was on my mind was how to protect and safeguard the cyber attacks. Lalit, I'll start with you and then reach out to Latesh.
Yeah. No, I think it's the protection of when it comes to healthcare entities, the common basic principles of cyber don't change. It's across the board.
Okay.
I mean, like simple hygiene, what Latesh was talking about, everyone should be aware what the threats are, risk kya hai, and managing that. Awareness is there. Then comes fundamental techniques. Fundamental techniques कि अगर आप data ले रहे हो, आपकी custody में is encrypted, वो secure है, या जिसको जितनी access चाहिए, जितने rights हैं उतने ही मिल रहे हैं, उससे ज़्यादा नहीं. If you're relying on the third party, जब हम बात कर रहे थे पहले भी, अगर आप घर पे maid लेके आते हो,
right,
you do all the background checks and stuff. You need to do the same thing,
right,
and not just once. Constantly keep checking continuously.
So continuous monitoring.
Correct.
That's what you have to do it all the time.
Yeah.
So ये सब other techniques you have to deploy. The other thing is what you were bringing up earlier. See, healthcare has to keep itself advancing to the new age solutions. But when you're moving to this new age technologies and also migrating for the healthcare, going remote or advanced technologies, make sure that's built with security in mind. Not after the fact. अगर आपने वो check नहीं किए हैं, बाद में it will become a very costly affair Not to say there will be like actual patients or like the end users that will have the consequence or suffer the consequences.
Right. When these days as a patient you go to a doctor, the doctor simultaneously while interacting is making the notations on the laptop. That goes, I think, automatically to the insurance company, the feedback, the interaction.
It's there in their system. It doesn't go yet. I mean,
it takes a while.
So takes a while.
Okay,
yeah.
let's break this
That's
down.
a good thing you brought up.
Let's break this down.
Yeah.
The notion that the patient has is that the doctor is making the notations because they have to do their billing to the insurance company.
Right.
And of course they want to retain the history, the medical history of the patient as well. Here we are not talking about big hospitals. We're talking about small practices where the doctor is holding on to that data. How significant for these small practices to ensure cybersecurity, and how that data goes from doctor's office to the insurance companies to the billing places. So talk about that.
I mean, this is a very good topic which you brought up, because I'll tell you one thing. If you go to today in any doctor's visit, right, like clinical, like for a primary care physician, like for a regular checkup,
or even a walk-in clinic.
Yeah, walk-in clinic, anything like that, right? But if you're going for the first time, you have to fill up the whole paperwork, right? I mean, that takes another 30 minutes, right? And you're just killing the time. Second thing is, if you're going to the same existing provider, I mean, like for the last 5 years, they have the data, but they don't link that information outside their domain, which is it's sitting in their computer. Sab kuch hai, they are ready, keep it ready, but they don't link that information through an electronic health record like EHR. Like there's a system by the name Epic, and there are market mein Epic hai, Cerner hai. There are bigger companies. They provide direct connectivity of the information of the patient into the hospitals, right? Let's say you need to go for
a centralized platform.
Centralized platform. So that piece, Abibi, is still lacking big time, because everything is there, but there is no connectivity. There is no integration. There is not information passing to the right hospitals at the right phase in time.
Maybe from the doctor's practice, they would be thinking that they don't want the client
there's
data.
A mandate. There's a mandate coming from the. Initially, pre-COVID, sab kuch chalega on paper. Everything was okay. After COVID, because they want to make it more digital, because people cannot go to the hospital without having the right level of information.
Right.
So the government has mandated through the CMS saying that by everything what you see here cannot be sitting on your computer.
Right.
And first of all, cannot be on paper.
Right.
That's the first thing. Make it more digital.
Right.
Uske baad, take this information and make it more interconnected across hospitals, across clinicals, across community hospitals, and those kind of things.
The challenge, though, what it comes is when you're like in a larger hospital chain, you're a larger provider, you're peer, you can actually now, split the cost between multiple units. So like, put the same solution, it gets consumed. The challenge with the smaller, office, like the service providers or like, the physicians and those offices, their main business is not cybersecurity. Their main business is healthcare.
Correct.
For them, like that's the first and foremost paramount.
Right.
Yes, you ask me to regulate it, like, and everything else, but they're looking for the right set of solutions. Where they're not really connecting the dots is those solutions are now available, but they have to make an attempt to build that into their own cost models as well. I had this very interesting conversation with one of the large entities in the West Coast here. They deal with like the smaller 1 to like 5-person physician offices, and they have a network of almost like close to 900 physicians like that. And I asked them, like, listen, as a hospital chain, you have a very high mission in hand. What about like the physicians that are like serving independently?
Right.
They said, like, we do provide them like other kind of shared services, like just go invoicing ke liye help chahiye, ya procurement ke liye help chahiye, ya consulting, like those kind of things.
The pharmacy benefits, those kind of things. Yeah.
But for the cybersecurity, whenever we approach them like to do this, they feel this is the cost burden. I said, what if like they can carve out $500 to $1,000 a month?
Right.
You get a solution like a consortium. Because sabhi matlab jaise 900 hai, 900 kya matlab, maybe like the 300 offices, right, between 900 physicians. What if everybody carves out 1,000 rupees a month, and we get a solution which is a shared services solution? That seemed like an expensive affair. Now, how is that expensive? $1,000 like a month for a physician office to really kind of like manage the healthcare. So that awareness and like the risk value proposition has to be understood.
Great insight from both of you. We're going to take a quick short break over here. We'll be right back after these messages. Gentlemen, once again, thank you so very much for joining us for today's significant topic, impact of cyber on healthcare sector. Viewers, before we resume back on the topic, first, let's take a quick look at the CyberWatch news flash. Online services disrupted at Seattle Public Library as ransomware attack looms. The Seattle Public Library is working to restore its online services after falling prey to a ransomware attack over the Memorial Day weekend. The cybersecurity incident, identified on May 25th, has disrupted access to a range of digital resources, including the online catalog, e-book and audiobook platforms, public computers, and in-building Wi-Fi. In a statement, the library acknowledged the attack's impact, stating, "This disruption began impacting access to staff and public computers, our online catalog and loaning system, e-books and e-audiobooks, in-building Wi-Fi, and our website." The attack struck just a day before planned maintenance, catching the institution off guard. While physical locations remain open for visitors to check out materials, the library's ability to process returns and new arrivals has been hampered, leading to anticipated longer wait times as staff manages the backlog manually. All right, so let's resume back to our conversation. What steps should the patient take if the data breach happens? For two reasons. One, of course, their information is out in the public domain. Second, the services got stopped. They were unable to receive the services. And if they want to make somebody accountable, how do they protect themselves?
If your information is leaked or is being breached outside, like a third party or the hospitals, the best way to do is outreach to the hospital. Like, you find out any hospital being going on a regular basis, has information been out in the market, has something happened to the information. They, as per the HIPAA law, they have to share the information.
Right.
They have to make sure they'll let you know, okay, it has been compromised. Your next step is what do you do with the information compromised? Kya karna chahiye? So they can say that too. They will give a couple of options, whether you can change the doctor or they can, come to the same hospital with some additional incentive they can offer, or they might say, you can go to some lawyer or something and do whatever the next step is, right? So there are multiple ways they'll offer you at the same time. The second option is, as a patient, you got to make sure that you actually report that information to one of the CMS healthcare or at the compliance level, saying that, hey, my information has been hacked or been compromised. Help me the next step, what I need to be doing, right? The first thing is you're talking to the hospitals, the clinicals, and all the other things. But you also have to take an extra precaution or additional step to talk to the higher authorities to get more information and how we can protect in the future this will never happen again. So those are the two major steps you can do. And the third thing is, then make sure you're not going to any mom and pop hospitals, you're going to the more branded, reputed hospitals in the future, and that level of monitoring alert is being set.
Yeah. No, I think Latesh has covered really well when the breach happens, and by law, and by provisions, if the breach is, larger than certain entities, number of entities, they have to disclose.
Right.
And after that, like Latesh very well described, what actions you can take. I really want to change the course, that's still reactive way of doing it. Yep. In the new age, and this is for anyone in the audience, you got to be proactive, not reactive. And the proactive means just how many of you watch your bank accounts every week at least to make sure bank money is still intact?
Right.
You don't wait for next year to watch okay, my money is still intact or not, right? There's certain things you do, monitor on a regular basis. This is exactly what you should be doing, in the critical services, especially when you are, the patient of where you're being monitored insulin remotely or very critical health kind of segments.
Right.
You better be proactively checking whether your provider or the service provider or the doctor has that services which are also secure if they're being digitally given to you.
Before we wrap up, any final remarks coming in from both of you?
I think one of the main focus should be around the security awareness and training, which I think people have to comply, people have to go through the training process, make sure they know what they are doing within the company, outside the company. That is something you have to follow. The second thing is they need to have right security controls and monitoring process overall within the corporate world, because tomorrow there are some bad actors who comes in, they do some bad behaviors, and ultimately somebody has to pay a big ransom money or they have to sign a big fat check, right? So that has to be stopped, which is like, remember the Lalit mentioned, like, it's more proactive than reactive, right? So that has to be defined very well in the company.
See, the time has come, Vikas, that hospitals and healthcare entities used to take pride in the quality of patient care.
Correct.
When the patient care was purely physical, great. Like the patient care quality is also, the nature is the same.
Right.
When your patient care has now become more digital, the mindset, the culture has to now start shifting.
Yeah. Mm-hmm.
The healthcare entities need to start like putting the KPIs or like measurements or the metrics, how digitally secure and the quality of digital care I'm providing.
Mm-hmm.
We don't have that kind of metrics yet. That's number one. The same way as a consumer, don't think this is their responsibility. You as a consumer also has to ask the right questions, and before sign up, this should be part of your criteria.
Viewers, this brings us to the end of our today's episode of CyberWatch. If you have any questions, queries, concerns, feel free to write us at cyberwatch@tvasiausa.com. And yes, CyberWatch is powered by DigitalXForce at iTrustXForce. So if you want to reach out to Lalit Ahluwalia, Lalit, what's the best way out?
Well, through our website channels, the digitalxforce.com or iTrustXForce.com, or through our social media channels, like, we are always available.
Lalit and Latesh, thank you so much for sharing your knowledge and expertise with our viewers. Viewers, until next time, this is Vikas Nangia signing off. Thank you for joining us.